Thank you, Helen. I will be talking about WHO's guideline development work on wasting. A joint statement by the principals of the key UN agencies was released in July last year, calling for more consolidated action to prevent and treat wasting, and mentioning that WHO would publish comprehensive updated guidelines in 2021. These guidelines should ensure that families with wasted children can access life-saving treatment, but with very much an increased focus on the prevention of wasting. The GAP framework that followed in February 2020 reiterated WHO's mandate to update and develop guidelines on wasting. WHO, in collaboration with UN partners, convened a technical consultation on the prevention and treatment of wasting in children in December last year. The meeting aimed to review the technical framing of wasting and to identify key gaps in the guidance on wasting in children. The outcome contributed to the development of the content of the GAP, the Global Action Plan framework. The meeting highlighted the importance of understanding what defines nutritional vulnerability and risk of death, not only anthropometric, but functional recovery as well, and what are the individual and population factors that lead to higher risks. Also, how can regional or contextual differences in prevalence, treatment response, and mortality risks be understood? For example, seasonal patterns, relationship with previous wasting and stunting. There are therefore challenges in determining a package of interventions for prevention, how to deal with multiple risk factors in different contexts, and risk factors during the early stages of a child's development, for example, in utero. It is also not fully understood why in the same environment, some children develop wasting and others do not, and how differences in age and geography affect these interactions. A WHO guideline is any document developed by WHO containing recommendations. Steps of this development process are reflected on the slide, going from determining whether guideline is needed through to its publication. Details on this process are found in the WHO Handbook for Guideline Development that is available online. Now to scoping the guideline, the focus of this webinar is on prevention. So I will just go through some of the examples of questions for the guideline in the area of prevention, both at the population and at the individual levels. The first example is, what is the effectiveness and cost effectiveness of population-based interventions for improving the quality of food security and intake in the prevention of wasting in children? The second one, what is the effect of maternal health and nutrition interventions on the prevention of low birth weight? It was reported that about half of infants with wasting at 6 or 12 months of age have low birth weight. And this shows that the importance of addressing low birth weight in prevention efforts and also addressing maternal nutrition. And the third, how can community-based nutrition prevention programs, besides early detection and treatment of child wasting, be integrated into primary health services effectively and other systems? Now to my last slide. Just some key points to remember. The first is that guidance gaps on the underlying causes need to be filled based on available evidence. And the second is, it is important to understand the basic causes in a certain setting when it comes to the implementation of the recommendations, rather than a one-fit-for-all approach. WHO's guidelines are based on existing evidence. Therefore, it is key that research includes more context-specific issues and be done in different geographic regions, including multi-sectorial considerations. Recommendations need to be adapted to local settings and contexts. Tools need to be developed to help countries with appropriate implementation based on their context. And involvement of key multi-sectorial stakeholders is important. We've seen some of these examples presented by previous panelists on how this has been done. Thank you. Back to you, Helen.